what I mean in great detail about leveraging technology to drive customer satisfaction is to deliver that clinical excellence. For example, using a CT scan. I was one of the first dentists in Tampa in 2011 to invest in a CT scan, and lots of dentists were saying, oh, you can do it without, freehand is fine, and it works. And it does work, but it does not deliver the wow experience, and it is not as exact as if you have that technology in your practice and use it properly.
I also think the other thing is like the market really matters too, right? So if you're in a really low income area and you do free exam and x-rays or you do free CT scans, you're probably not going to get the results that you want because they can't afford the treatment. If you're in a higher income area, then you're going to have a different outcome. So there's a lot of variables on that. Welcome back to another episode of the Full Arch Advantage podcast. I'm your host, Gary Bird. I'm the founder of SMC National, where we help you create, convert, and close more full arch cases so you can grow the way that you want. And today I have Dr. Sarah, who is the founder and clinical director of Full Arch Success. And she's going to share her journey of how she used technology to go from 1 arch a month all the way up to 15 arches a month. Just this last month, had a great month. And she's going to explain how she uses technology to make the patient comfortable and the patient journey smooth. This is a really good episode. You're going to want to stay tuned. All right, we are live and I'm excited for this conversation. So Dr. Sarah, why don't you tell me what is the number one thing that you're seeing that's helping doctors grow their full arch cases?
Hey, Gary. So I would say, of course, education matters big time, but really delivering clinical excellence by utilizing technology and leveraging technology to its maximum. I think that's the way we can grow our practices tremendously and beyond our dreams.
Awesome. So what does that mean exactly, right? So a lot of times people say, they'll use a vague word like AI, right? And so you look at AI and it's like, okay, what kind of AI? Are you talking about like machine learning AI? Or are you talking about AI that reads x-rays, which is totally different, right? And there's like,
yes.
and then are we really talking about AI or are we talking about human kind of driven technology that isn't quite there with AI technology yet? So when you say that, like, could you drill down on that? Like and I'm going to give you a person to talk to. If I'm a dentist, I own, 2 or 3 practices and I'm adding full arch to my practices. Like what exactly are you talking about when you say that?
So what I mean in great detail about about leveraging technology to drive customer satisfaction is to really deliver that clinical excellence. For example, using a CT scan. I was one of the first dentists in Tampa in 2011 to invest in a CT scan, and lots of dentists were saying, oh, you can do it without, freehand is fine, and it works. And it does work, but it does not deliver the wow experience, and it is not as exact as if you have that technology in your practice and use it properly. And we can use the CT scan not just to prepare ourselves for our surgeries, which is really paramount, but we can also use it to educate our patients. So if you provide a consult, for example, I provide free consults to all of my patients. Everybody gets their first CT scan free of charge because it removes a barrier to treatment. And there are always barriers to treatment. So I sit my patient down, I've taken the CT scan, they see that scan, and first of all, it's a wow experience, right? They're like, whoa, is that me? And they're either grossed out or really intrigued or both. And then you can show them, for example, where the bone is missing, if they need a sinus lift, or if the dentition is terminal and there are just a few teeth here or there. If they see that, that's a great educational tool, which will sell you a lot of cases. I thought my CT scan back then was an expense, but it actually turned out to be a great investment tool. I got my ROI on it the very first.
Hey, sorry to interrupt the show, but I want to make sure that you're going to Dicoma 2024. It's July 10th through the 12th. And guess what? We are going to be speaking on the main stage and we're going to be hosting a boot camp as well. And we want to give away some free tickets. So how do you win these free tickets? You go to smcnational.com, click the little bar that says enter to win free tickets to Dicoma, and then you submit your information and everybody's a winner. We're going to be giving a discount to everybody who enters, and we're going to be giving away some free tickets to the conference itself and to the boot camp. Make sure you sign up for these right away. Back to the show.
Months.
Wow. That's really, really good. So I want to post something to you and get your thoughts on it. So recently I posted something in a dental group and I said, free exam and x-rays. What do you guys think about them? Yes or no? And I would say 95% of the dentists were like, absolutely not. Never give anything away because you never get anything of value for free and patients aren't going to appreciate it and they're not going to like it. Then there was like 5% of dentists, and this had over like 200 comments on it. And I posted in multiple different groups. So probably in total, close to like 300 to 400 comments on it of dentists. And like, I would say 95% said no, but then there was like 5% that said, oh yes, absolutely. And it works great because it actually lowers the bar of entry to get this patient in. And then I can educate them on their problem without that friction of $99 for the exam or $99 for the extra or whatever. What are your thoughts on that? How do you look at that? And has your mindset kind of changed about that over time?
It's a really good question. Yes, it has changed, but in a sense, it's always stayed the same. I would not give away a free comprehensive exam. I would only give away a free consult. This is to meet the doctor. You're not creating a whole diagnosis treatment plan for X number of crowns and fillings and root canal treatments. That is hard work that you need to really spend a lot of time working up appropriately. The consult with a free CT is a meet and greet with a doctor. Also an opportunity to showcase your practice, make it a really VIP experience, give them a tour, have the team members brag about the doctor. I spend about 10 minutes with the patient during that free consult, and I review the scan. I do a radiology review, which takes me about 2 minutes in front of the patient. And then I tell them whether or not they're a candidate for implants. If they are, then I schedule them for the exam. And I will schedule them for treatment. And after treatment, I always take a CT scan to check my implant placement. And the patient gets quoted for that scan and pays for that scan and willingly. Like I said, I started this in 2011, and I think back then my fee for the CT scan was $375. And over the course of all these years and thousands of implant placed, hundreds of patients treated, I had one person argue me over that post-op CT scan charge. And clearly, she wasn't a good match for my practice. I didn't offer her treatment when I realized she was really arguing me on that. So I'm kind of giving you the split answer. Yes, I agree with the 95%, and I agree with the 5%. It really depends on what you offer.
Yeah, and there's a lot of nuance to it too. And I also think the other thing is like the market really matters too, right? So if you're in a really low income area and you do free exam and X-rays or you do free CT scans, you're probably not going to get the results that you want because they can't afford the treatment. If you're in a higher income area, then you're going to have a different outcome. So there's a lot of variables, if I could talk properly, on that. So what other technology, when you say, okay, technology is like really the way to go, what other technology that needs to be there to make sure that the patient has a really good experience? Because sometimes I'm a patient, right? Like, so I'm not a doctor. So sometimes I see technology like what you just explained about the CT scan, and I'm like, that's really cool as a patient. Sometimes there's other stuff and they're like, there's this X5000, and all I'm thinking in my head is like, wow, this is probably going to be expensive. So how what other technology is like really important to have to make that patient experience really stand out?
Yeah. I'm glad you asked. So the patients hate the dentist because they expect pain and they expect embarrassment. And part of that is shoving a bunch of goop in your mouth just to take an impression. People have never enjoyed that. And they have terrible memories. Lots of people have bad memories of getting impressions taken. So intraoral scanning has revolutionized dentistry. The OmniCav, I think, came out in 2012. That's when I started jumping on the bandwagon. And then I actually beta tested the Prime Scan. So those are both. So the Prime Scan is a fantastic scanner. There are many other fantastic scanners on the market too. But if you're not intraoral scanning your patients, you are really stuck, not just in the last century, but the last millennium. It's standard of care, in my opinion, to take impressions with an intraoral scanner. And then also to use that data to fabricate stuff in-house. We've been 3D printing. I'm looking at 5-year recalls on my 3D printed dentures now. And
is that good? I'm not familiar with that stat. Like, what is that good? Is that awesome?
Yeah, most dentists aren't in-house printing yet. I think we have about a 20% market penetration at this point. But back then it might have been like 1 or 2%. And the materials weren't that great. So the materials have been far developed since 2018 or 2019. And it's really nice to be able to fabricate these. So when you take the intraoral scan, you digitize your patient, meaning if somebody needs a denture, I take a digital impression of their gums, and then make them a denture based on a digital design. And so then let's say the patient loses or breaks or whatever happens to their denture, they need another one. Well, in the analog workflow, you have to bring the patient in, take these goopy impressions again and set it all up in wax and hope it's right. And then 3 weeks later, you have a try-in. And then 3 weeks after that, you might deliver it. Or if you have the patient digitized, the patient calls and says, I lost my denture, they threw it out. You hit reprint and you bring the patient in the next day and you give them their new denture. And that's a kind of a service that's just amazing to patients. And they actually demand it by now, because when they order something online, it gets dropped off the same day. So they don't want to spend the next 9 weeks or however many weeks, hoping that they're going to get another set of teeth. So kind of important to distinguish yourself in the market like that you can provide this to your patients. And also it's a much nicer experience for the team. Nobody wants to shove a bunch of alginate or PBS in the patient's mouth, right? We want to provide state-of-the-art care to our patients.
That's so cool. I love that. So how does this help you as you started to piece this together, right? So you probably started doing full arch without this stuff. And then you added one and you're like, wow, that's good. That makes it smooth. And then you added another component of technology and you're like, wow, these really play well with each other. And then you added another one. And so You've been working on this and developing this. How has this helped you when you put it all together to be able to do more arches? Like when you started, how many arches were you doing? And then now how many are you able to do?
So I did start the restorative process analog. When I was doing the surgical process, it was always digital. But the restorative process is an important process. And a lot of dentists don't do the surgical aspect. They prefer to do the restorative aspect, which is wonderful and a great choice. So when we were doing it analog, not only was it uncomfortable, it was also less accurate. Now, the toys keep getting better and better. And so for Christmas about 4 years ago, I got into photogrammetry. And so that's a really accurate way to capture the implant positions in relation to each other so that we get a passive bridge, meaning when we put the bridge in the mouth, it doesn't wobble right and left. It sits in one way and one way only. And the beauty of that is, first of all, your delivery visit is no longer stressful, but also you will most likely never see the patient again except for recare visits, meaning the list of complications that can occur of screws breaking or loosening or veneer fracturing or anything else, implants actually flowering sometimes, often are related to a non-passive fit of the bridge. And so the quality of life for the dentist goes way up when they don't have people calling with problems. And also it clears up their schedule to do more arches, which is crucial. You cannot afford a 10% complication rate on anything in dentistry, whether it's your fillings or your crowns or your implants. And so when I started, a few years back, I was hoping to do whatever I could, but maybe an arch a month. And now I'm predictably doing at least 10 arches a month. Actually, last month was a really good month. I got 15 arches last month, and we got really busy. And it's wonderful because it's so predictable. We have a real rhythm down now, a flow where the patients get predictably educated. We have pre-recorded videos to get them ready for surgery, to get them taken care of after surgery, to show them how to take care of these new teeth that they spend quite a bit of money on and are now highly motivated to upkeep. And it's just a nice day at the office when you have low complications and you deliver these smiles, these life-changing treatments.
Yeah, that's awesome. Yeah, I was meeting with another doctor and he said, a lot of dentists say, my goal is to make my patients smile or give them a new smile. And he said, mine is to make them cry tears of joy because I've changed their life. And I was like, man, that's so good. I love that so much. And it's the one area in dental that you actually get the opportunity to do that. Like, and doing a filling or a crown and all those kind of things and getting people out of pain is great. But let's be honest, no one ever breaks down in tears because you fixed it for them, right? But when you transform someone's smile for them and make it so they can eat and interact with the world again with confidence, it's really a game changer. And so that's really awesome. So tell me a little bit about your courses, because if you're doing 15 arches a month, that means you're doing about one a day if you're doing Monday through Thursday, right?
Oh, no. I'm doing 2.5 days a week. I do surgery Monday, Wednesday, and then I come in half a day on Thursday. So you're doing like 2 a day then. So, right? Is that about right? So my goal is 4 arches. My goal is 3 arches a week, Perfect. So it balances out. And, like any business, sometimes you're busy and sometimes you're less busy. But I have a true passion for making dentists' lives better. And that could be in becoming better clinicians. That could be in being better advocates for your own wellness. That could be in better running your office as a leader and having higher quality of life because your team respects you and listens to you and wants to pull super hard for you because they're invested. And so we offer live patient surgical and restorative training for the dentists and actually also for their teams here in Tampa, Florida. And because it is live patient care, which is how I learned best, and most of my students would agree that there's nothing like actually doing the procedure. We do didactics online ahead of time to prepare, and then we have surgical weekends. And we have a beginner course, but we also, our flagship is the Full Arch Bootcamp course. And we have that in freehand and in guided options, where you observe, assist, and treat 5 arches over the course of 3 days. And with that real life hands-on experience, you can now really see the process start to finish and ask your questions that come up when you're in live patient care that don't come up if you're just listening to a lecture. Now, since it's live patient care, it's exclusively for Florida licensed doctors. Florida does not have some sort of visiting license, so we're unfortunately not able to provide this for doctors who don't have a Florida license. But there are plenty of Florida licensed dentists that need care, and since we're doing this in very small group setting, it's certainly something that we'll be busy with forever because there are plenty of Florida doctors that need to be trained.
Yeah, there's a lot of Florida dentists, and it's hard to get in there. Florida just doesn't let everybody in to do this kind of dentistry on purpose because there's definitely a good demographic of people that need this type of treatment there, and it's sunny,
huge,
and a lot of retirees. So, what is the best way if someone wants to learn more about this? And even if they're outside of Florida, what's the best way to learn for them to connect with you and learn more about you?
They can visit fullarchsuccess.com and then peruse through, and there's my contact information there as well, fullarchsuccess.com.
Awesome. Well, you did a great job today. I learned something. That's my goal every time, is to learn something. And I love what you're doing. Keep up the great work. And thanks so much for sharing it with the world.
Thanks, Gary.